It's often known as the silent killer. We have a doctor in the house to talk about hypertension and stroke. The Health Source podcast starts right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Welcome inside the Marshall Health Source podcast studios on the campus of Marshall University. I am Rick Lord, and today we will be talking about hypertension and stroke, some things that affect millions of people throughout the country. And we're happy to have an expert in the house, Dr. Jason Adams, joining us today. Doctor, thank you so much for your time.
Thanks for having me.
First of all, before we deep dive into this, I want to give you a chance to talk a little bit about your background, what got you interested in this field, and what brought you to the Marshall Health Network.
Oh, okay. Well, thank you for the question. I
didn't mean to throw you.
No. Well, I'm from Huntington.
Sure.
Actually, I'm a local. I grew up here.
Okay.
I knew that I wanted to be a doctor and help people. From time I was pretty young, something I more solidified when I was in college.
Yeah.
I picked neurology because it's one of those specialties that was puzzling to me. It was a mystery, and I enjoy puzzles, as many neurologists do. I really wanted to use my brain to help other people's brains.
Sure.
I guess.
Makes sense.
That was dumb.
Not really.
Oh, man. But, when we're talking about what neurologists actually treat, it's strokes, it's seizures, it's these, really interesting inflammatory conditions.
Yeah, all-encompassing.
Yeah, it really is. And I like to think of it as it's an aspect where I can help people and really change their lives. Someone can walk into the hospital on their way to a nursing home headed towards disability. And
Right.
with, modern medicine, we have interventions where someone can walk out the door like nothing ever happened.
Crazy.
And very, very lucky patients. So it's nice to be able to make a meaningful impact in people's lives.
So when we talk about things like stroke, a lot of people have heard like the big warning signs and everything, but in many ways, are there maybe some things that people aren't feeling that are just as important? I mean, I know that's kind of an abstract question, but people know the big signs, but are there maybe some underlying signs that someone watching or listening might not know about?
Well, everybody knows, the FAST acronym,
Yeah.
with face, arm, speech, and time. Get there as fast as you can. But the way to really think of a stroke so they don't get missed is it's a loss of something. It can be a loss of anything. It can be a loss of your visual field. It can, present with unilateral weakness. Most strokes do present with a unilateral symptom, one side or the other. Just not being able to feel, maybe a tingling sensation going up the side. And some of the symptoms can be extremely subtle. And I think that's one of the, the big fallbacks in sort of stroke education for the general population is people don't expect the subtle strokes. They're looking for that big one. They
Right.
get that big one, or they can't do anything, and they're paralyzed on half their body. They're going to the hospital. But more often, that weakness can be subtle, and someone can sit at home for a day or two thinking, you know what, I'll go tomorrow. It'll be better tomorrow. But that's not how strokes work. Time really is brain. We only have a few hours to give a thrombolytic medication, the clot-busting drug, and we have 24 hours to do a thrombectomy with an interventional radiologist, but really time is brain. You're having tens of thousands of neurons die, every single second. Yeah. So the faster you can get in recognizing the stroke symptoms, then the better chance of having a good non-disabling outcome.
And obviously, for most people, if something like this were to happen, the protocol is you call 911 and then you wait.
Yep.
Is there anything that you can do in the interim while the ambulance is getting to wherever you are to increase your chances?
Well, we actually see a lot of people do make some mistakes on this point. When you're having stroke-like symptoms, you really don't want to jump for an aspirin, the same way people do for things like heart attacks. Okay. Because you could have a bleeding stroke. And most strokes are ischemic. In America, we're looking at 70-80% of strokes are ischemic, meaning part of the brain isn't getting enough blood and oxygen. And in that case, aspirin would be extremely helpful. Right. But you don't know that it's not a bleeding stroke.
Which would be a hemorrhage almost.
Yes. So if you're hemorrhaging, aspirin's the last thing that you want to take. So really, the most important thing is just calling 911, or getting to the ER as soon as possible.
Is there a link between hypertension and stroke? I mean, hypertension, high blood pressure, something that millions deal with every day. Have you found a direct causal or correlative risk?
Yeah, so hypertension, also known as the silent killer, really is exactly that. They actually did a landmark study, I think it was published in 2016, called the Inner Stroke Study, and they looked at a population attributable risk. And what population attributable risk, or PAR, is if they could eliminate that risk factor entirely, how many strokes would they get rid of?
Okay.
And when they look at hypertension, it's actually the number one population attributable risk factor. If they could get rid of hypertension, if someone didn't have hypertension, the whole entire population, then strokes would probably be about 50% less.
Wow.
That's huge.
Yeah, that's a massive number.
Yeah.
So, I mean, when you're talking about hypertension, people hear things like high sodium, things like that. Are there any other like easy fixes for people? And beyond that, I know this is a multi-layered question now, but is there a specific group that you would consider more at high risk?
Well, everybody's at risk, unfortunately.
Right.
Some people get lucky. Genetics. They can eat whatever they want, do whatever they want, and high blood pressure is never really an issue for them.
So that is, let's go into that first, because I always find that fascinating, because you can almost make that point about any health concern.
Yeah, you really can.
There is a balance between things like genetics and lifestyle choices and sleep and stress. All of that plays a role. But have you found in your studies that genetics can make a huge difference, or is it just one of many?
Well, when they look at different populations, they do find that certain populations do have higher stroke than other populations. Right. But then there's always the question of is there something that's hiding underneath this that's causing it? Is it an access to health care?
Yeah.
And when we're looking at global populations, our health care
the socioeconomic.
Yes,
yeah.
Exactly. So healthcare is different, all over the world. But when we're talking about, genetics and modifiable risk factors, that's how we really break it down for stroke. We have non-modifiable risk factors, things like our genetics, who our parents are, just strokes and heart attacks run in our family. Age, no matter how we try, we can't stop getting older. And age itself is a risk factor for stroke that we just can't do anything about. Yeah. But when we're talking about modifiable risk factors, they're things that we can treat either with lifestyle or, with medication, things that we can do something about, like hypertension. We can change our lifestyles, and when that doesn't work, when we're doing everything that we can, we have medications for that.
So let's take it step by step, because obviously medication would be something that you would try down the road if what you were doing wasn't working. When you talk about lifestyle choices, obviously the typical things like exercise, nutrition. Is this something that you can out-exercise your way out of if you don't have a good diet, or do they both have to work hand in hand?
Well, it's really a combined approach on all aspects. When we're talking about strokes specifically, we want to get somebody's modifiable risk factors under control as soon as possible. I tell patients all the time, you're most at risk for having another stroke right after you have a stroke. You've had this untreated high blood pressure, untreated high cholesterol, maybe untreated diabetes. We got to get those things under control as soon as possible, because the longer you're going, every day, every hour, you're doing more damage to your blood vessels, putting yourself at a higher risk of having a stroke in the future.
Wow.
You're certainly not getting any younger during that time.
Well, yeah, none of us are.
Yeah.
So when it does move into the stage where you start recommending medications, a lot of people can be apprehensive about that. What are some of the misconceptions that you've seen that a lot of people have about high blood pressure meds?
Well, as someone on antihypertensives myself, when you think of taking medications, you think yourself, I'm healthy, I'm not sick.
Right, or I don't need drugs.
Yeah, and I think that's really the biggest misconception of it. We live in a modern world with modern medicine. If we can take something, that can lower our chance of having a stroke, why not? Why not deal with the risk factors? Type 1 diabetic is what I am. I got the worst type of diabetes you can have.
Oh wow.
And I have to keep my diabetes under control every day because I know it's such a huge risk factor for things like stroke and heart attack.
And something like that is lifelong maintenance. Yep. Is that, for the most part, does that carry over into hypertension medicine too? Is it something where once you get them on that regimen that it's lifelong and that you just got to make sure you're taking your pill every day?
Well, sometimes people can come off of things like antihypertensives or even diabetes medications, but that's a decision, to discuss with your doctor,
right.
When you have those situations. Obviously, we all want to live as healthy lifestyle as we can, but it's hard.
Sure.
Life gets busy. I stopped and got some fast food on my way here. I was working, busy, and it was just fast and easy. We all do it. And unfortunately, with our Western diet and Western lifestyle, it probably does put us at a little bit higher risk for things like strokes and heart attacks. But with our modifiable risk factors, things like high blood pressure, high cholesterol, diabetes, these are all things that, we can monitor. We can see how we're responding to treatment. We can adjust treatment, as necessary, which is often the case. Just because you're started on one antihypertensive medication doesn't mean you'll be on it forever, but it also doesn't mean that you might not need to escalate therapy down the road. So it's very, very important to keep follow-ups and keep these things under control.
So for someone who's watching or listening right now who might be in that high-risk category, they might have it run in their family, maybe they do have high blood pressure, what are a couple of impactful things that they can start doing today that could really lower their risk?
Well, number one is know that you have it.
Awareness. Yeah, sure. It sounds simple, but true.
It really is. There's so many people walking around, that I see them, they never go to the doctor. And they show up in the hospital, with stroke-like symptoms, and you talk with them. You say, you know what? Looking at all of your risk factors here, it looks like you have high cholesterol, you have diabetes, you have high blood pressure, and it's interesting to see how many people are really surprised. But it is you don't know that there's a problem unless you look for the problem, and right. These are things that your primary care doctor will screen you for. So if you don't have a primary care doctor, I would recommend going and establishing with a primary care doctor, today.
Right. And then what would be something else that they could do? Just in terms of, is it just diet and exercise? Is it really that simple, or are there other things that maybe they're not thinking about?
Well, you certainly just want to live the healthiest, lifestyle that you can. And, as a blanket term is yes, diet and exercise. But, there's also other things. Really lifestyle comes into that. Sedentary lifestyle is just a huge risk factor for stroke. And it's easy to have a sedentary lifestyle. We talk, most people they're working all day, maybe eating fast food because they don't have time. Then they get home and they're tired and don't want to work out. You just have to make time for those types of things.
And it's turned into that type of society, especially with the younger generations. My kids, I have to get them off their screens. They want to just sit there and play with their iPads. It's like not when, well, I'm a lot older than you, but when we were growing up, it's like you're outside, you're playing. You don't have a choice. You're out there riding your bikes, all day. Yeah. Mom says come back before it's dark and dinner will be ready. But So is that something that you work with people that you are patients of yours to talk about maybe passing along to the next generation as well, knowing that it's going to be even more of a challenge for this generation coming up?
Oh yeah, all the time. Exactly what you were just saying. Even when I was a kid, that's all it did. I get a weird feeling in my stomach if I didn't go outside.
Right.
If it was a sunny day outside, I had to be out there.
Yeah.
I've got a child, and I have to force him to go outside. Unfortunately. So I could definitely see the incidence of things like strokes and heart attacks increasing for the next generations, unfortunately.
Well, then let's flip that and say, are there any things that you've seen come up in terms of technology or just the way that medicine's evolved that have you excited about maybe treating this in the future?
Yes, there really are, and it's pretty crazy when you start talking about it. But even genetic engineering, they're looking at a therapy right now for genetic engineering that will lower your LDL by like 80%. LDL is the bad cholesterol that's associated with
80%.
80%. Never have to take another cholesterol medication again, which is interesting.
So how's that work?
Well, I'm not really sure.
Right. It's in the testing stages right now.
Yeah. I honestly, I wish I could would have read a little bit more about it before, but I know that is something something in the works that they're testing right now.
All right.
There's certain populations again on the planet that they can eat whatever they want and their cholesterol never goes high. Yeah. So it's pretty much just figuring out what those genes are and then adjusting.
That makes it challenging because everyone does have their own very personal health profile. Mm-hmm. So just what works for one person might not work for someone else. So you do have to figure out what works best for your body and the way that your body handles things. As a neurologist, brain doctor, you see a lot of brain disease atrophy when you have something like a stroke. Is that can brains heal themselves eventually, or do some things take longer than others? And how's that process work?
Well, it's a very interesting and unfortunate process. Unfortunately, once an area of the brain is dead, or the central nervous system, the spinal cord, it's essentially gone forever. Mm-hmm. However, other areas of the brain can rewire themselves. And it's actually called neuroplasticity. The younger and healthier we are, that process probably works a little bit better, but it never really goes away. So that's where recovery really comes from stroke. And when we're looking at strokes and we're looking at the studies of strokes, we're looking months down the line. 3 to 6 months down the line is where most of the studies are for recovery after stroke. I can see a patient, in the hospital with an acute stroke, who's hemiparetic, maybe a little bit of ataxia, trouble with some coordination. And a few months down the line, a lot of those patients, just looking at them, if you didn't know, you'd never even know that they had a stroke. And where that recovery is literally the brain rewiring itself around there, and different parts of the brain picking up the job, that was lost, almost like carrying your fallen brother in combat, picking up the job that they would have done. So that's where recovery comes. But unfortunately, at this point in time, we cannot regrow brain tissue or anything like that.
So what would your advice be for people who, we like to say that this is a podcast that helps people on their journey to wellness. So if anyone has a loved one or someone that they're close to that might be a little bit more at risk, the talks that they need to have with them about, like, you talked about, hey, just make sure you have it. I mean, that's where you start, is just going to your doctor and seeing what your family history is and what might. But in terms of just like day-to-day living, beyond the ordinary, because it gets tiresome to say eat well and exercise. People get it, right?
They do.
And get off your butt and get outside.
I'll tell you what, though, my wife's actually a dietitian who also works for Mountain Health Network.
Okay.
And it's surprising when we say eat well, a lot of us really don't know what
right, and that's
well
kind of
really
where I was
is.
going with this. Is beyond just the blanket statement, are there any specific like types of food or combinations or anything that certain types of exercise or that you could recommend for people that might just be like, you know what, I do need to start doing this differently, that you can get specific on?
Yeah. Well, actually, abdominal people who store their fat here, like myself, actually are at a little bit higher risk.
Really?
For things like metabolic syndrom, strokes,
Why is that?
and heart attacks. I'm not really sure.
Just is what it is.
Yeah, just is what it is.
Okay.
One of the correlations that they
Interesting.
found. But cardio is always good. Yeah. Eating these healthy diets, it's really just getting away from the Western diet. Unfortunately, the Mediterranean diet has been well studied. I think a previous guest might have touched on it a little bit. The Mediterranean diet has been studied for secondary stroke prevention. And so far, just because we haven't really looked a whole lot at diet, but the Mediterranean diet, for what we have and what we know, is a good one. So that's usually what I direct people to, and I usually direct them to a dietitian. I'm an expert on the brain, but we have other experts who are trained in diet for all sorts of medical conditions.
So when someone comes to you, and I'm sure you get this a lot, and it's got to be a challenge for you when they say like, "Oh, I feel fine," but that they're not fine. What's the process like of making them understand how dangerous this really is? Because you might really kind of feel fine, but you don't understand it the way that your doctor will in terms of what this could lead to. You can't see around corners, right? So how do you navigate that with a patient to be like, listen, this there's free will, so you can only do, what's the saying, you can lead a horse to water, but you can't make him drink. But how do you deal with that with a patient that might be a little bit apprehensive, and to let them know that this is serious stuff?
My personal approach is I try to be extremely blunt on what a stroke can actually mean. For example, when I was first diagnosed with diabetes, my endocrinologist, he looked me right in the eye and he said, "There's 2 ways this can go. You either take care of yourself or you don't take care of yourself, and you lose your legs, lose your kidneys." And he said, "I'll walk you up to the dialysis unit right now and introduce you to people who can't walk on their own." And I'll tell you what, that scared compliance into me.
Sure.
So when I'm talking to patients about this, I really try to hit the point home that stroke is, depending on what study you look at, it's even sometimes the number one cause of long-term disability in the world.
Yeah.
And that disability isn't just, people think, oh, I'll have a stroke and I'll die and that'll be it. But there's things worse than that. You can have a stroke that disables you, and then you have to live another 20, 30 years, maybe unable to talk, maybe unable to swallow on your own.
And then someone else has to care for you, which brings that into the equation as well. So I'm in many ways, maybe you have to be almost a psychologist, because you have to figure out what's going to connect, because what works for one person, as we were talking about with their own health profile, also works for advice. You have to know what's going to make this person understand me in a way that maybe will get some action. Because being that blunt, worked on you, it might
Yeah.
not work on the next person.
I try to. I really, being from the community, oftentimes I am taking care of people who I know.
Yeah.
My dad was actually the first stroke alert of the night one night.
Is that right?
Oh, that was horrible. Yeah, he's doing great. But
That's good.
I try to look at people like they're a family member or a friend. So I do. I try to make that connection with them. Really make a connection and try to make a lasting impression. So when they leave, they'll remember what we talked about, and hopefully I can impact their life, something like that.
Well, that's a great way to put a bow on this. I couldn't have said it better myself. So just real quick for someone watching or listening, I'm sure as a neurologist, you're a referral, so they would have to go to their primary doctor first. But what's the easiest way for someone to get a hold of you? Maybe you connected with them today, and they're like, I want that doctor looking at me. How can they go about that?
Yeah. Well, all you have to do is generally got to be referred by a primary care doctor on the outpatient setting. I'm an inpatient neurologist, so I'm available. If you you show up to the hospital with a stroke, you will see me. I'll be there. But on the outpatient side, you can ask for a referral if you're having any neurological problems. That's why it's so important to have a primary care doctor. They really are the quarterbacks of healthcare. So if you don't have a primary care doctor, you might miss out on the referral for something that's treatable, whether that's tremor or some sort of neuromuscular weakness. Without those referrals and without that pivotal role of primary care doctors, a lot of these things would just fall through the cracks.
Doctor, thank you so much for your time today. We appreciate it. And we appreciate you for listening and watching. Again, make sure to like and subscribe. And until next time on the Marshall Health Source podcast, for Dr. Jason Adams, I'm Rick Lord. Take care.
That was the Health Source podcast, presented by the Marshall Health Network.